My name is Joseph Williams. I'm one of the physicians here at Sierra Regional Spine Institute. My journey started while I was born in Northern California in a town called Fall River and lived in a town called Bernie, California for my much younger years, and ended up moving to Reno at a young age and ended up going to Alice Maxwell Elementary School. I went to Sparks Middle School, and I went to Sparks High School and graduated Sparks High School as a railroader. From there, I went into University of Nevada, Reno, and ultimately was accepted to the University of Nevada School of Medicine. And back in that day, it was a combined Reno and Las Vegas. So we did our didactic school work, classroom work in Reno, and did most of our clinical rotations in Las Vegas. And so I lived 2 years out of Las Vegas. After graduating from medical school, I accepted a residency in Illinois and went back and completed that residency in orthopedic surgery in Illinois, and then completed a spine surgery fellowship out of Indianapolis, Indiana, for 1 year. As I was leaving my fellowship, I was recruited by the same people that had trained me in Illinois to come back and practice there, and ended up joining a practice where I had residents and med students underneath me, and practiced in central Illinois for several years until I got so homesick for Nevada that I ended up looking for opportunity to get back home to Reno. And that is when I found Sierra Regional Spine. My mom had an answering service. She owned an answering service back in the day, and she dealt with a lot of physicians. So somehow out of that answering service, I would hear Dr. Rappaport's name and Dr. Kipp's name, and then through friends and family here in town, not related to me looking for a job, but over the years I was familiar with who Dr. Rappaport and Dr. Kipp were. And it was a trip out to San Francisco with a friend where I just called him while I was in the car. I called the office, and actually the manager at the time, and she's still the manager, Caroline, answered the phone, and I explained who I was and what my intention of the call was to speak with either Dr. Rappaport or Dr. Kipp, and she was very kind and very nice over the phone, and set me up with a phone call from Dr. Kipp shortly thereafter. We had a long conversation, and at the time they were still deciding whether or not to recruit, and ended up about 6 months later, Dr. Kipp reached out and wanted to have a meeting, and the rest is history. So I dissolved my practice in Illinois. I was with a great group, and I just knew it was time for me to come home. And so I got back into Reno and started practicing in Reno in maybe 2022, and have been going ever since, and couldn't be happier. I have two sons, and they're both moved back out here with me. They're very happy, and the three of us are doing well. I knew I would go into orthopedic surgery in medical school. It was in medical school, you're kind of exposed to all the different specialties and all the different careers that medicine offers, from family practice to internal medicine to psychiatry to OB-GYN and the surgical specialties. And it was during medical school that I could see I was gravitating toward orthopedic surgery. As a kid, I loved to work with my hands. I'd build things with my parents, and it just seemed like the proper fit. I had worked for a construction company during my time in high school, and as a part-time job. I never had what I would consider a normal part-time job in high school, working at a grocery store or a restaurant. I worked construction during high school during the summers, and so it like I said, it just kind of seemed like it fit. The other thing about orthopedic surgery is I pride myself on my activities and the things I enjoy, being active and participating in, whether it be snowboarding or skiing or mountain biking. I also enjoy water skiing and jogging, running. So I know how important those activities are for me, and so I thought I could make the biggest impact with my skills, maintaining people's activity level. It brings me joy, I guess. I identify with people that are having dealing with an injury and are not as active as they once were. And then the physical portion of this specialty, the physics of it all, the biomechanics of it all, and the use of the instrumentation, the recreating normal anatomy is appealing to me. Being able to think things through and know what the goal is and what the need for the patient is in order to decompress nerves or reestablish normal anatomy that has either been fractured as a result of an injury or has undergone a significant amount of degeneration and has collapsed down. I enjoy minimally invasive surgical techniques because I've seen it with my own eyes how well these patients do. When I was in training in residency and in fellowship to some degree, I would assist on surgeries, spine surgeries, and I just felt that we could do a better job and cause less damage to the surrounding tissues with lesser invasive options. And so through my fellowship, I kind of gravitated to the attendings that were doing these techniques. And back in that time, it was somewhat at its infancy. And so being in Indianapolis, we were close to Tennessee, and there were some very good pioneers of minimally invasive techniques that were in Tennessee that my attendings were working with as well. And so that's kind of where I was introduced to it and really honed those skills in the first few years of my practice. I would gravitate and take courses, and the skills that I learned in fellowship, I just continued to develop and develop. Minimally invasive procedures have a steep learning curve, and so it does take a lot of cases to get the skills, but once you obtain those skills and once you refine those skills, the patient outcomes are tremendous. To me, it's not arguable at this time. The patients do better, the tissues do better, the risk of complications is substantially less, and it's just enjoyable for me to see patients have a condition that typically would end up with 3 or 4 days in the hospital, and they're in the hospital one day and they're up walking the day of surgery. And I love seeing patients not requiring pain medication. So those are all the things that make me happy and make my practice enjoyable, and just watching people get back to their activities that they enjoy and getting back to life. With seeing patients in clinic, in the practice setting, people come in or get referred for a multitude of reasons, but obviously it's going to be spine related. It's they've got sciatica, or they've got a degenerative condition, or they've got some issue in their cervical spine, and they end up in our clinic. And so those patients, it's nice because over the course of those visits with the patient and those appointments, you kind of learn about them, you learn about their families attending the appointments, and you really learn about also their medical conditions, the medical comorbidities they have. And when you compare that to being on trauma call, the trauma patients, you're meeting them for the first time. You really don't have the luxury of learning about them as a patient. It's kind of usually abrupt, and sometimes when it's a severe enough injury where they've got something that needs immediate surgical treatment, you kind of have to roll or get all that information in a very short amount of time in somewhat of a chaotic environment, because they're either in the trauma bay or they're in the emergency room where lots of things are happening. Multitude of providers are coming in, nurses, and EKGs are being done, and testing is being done, and so you're kind of getting just snapshots or quick brief periods of time where you can learn about the patient and that kind of thing. And also, typically some family may be in the room, but some family may not have been able to get to the hospital just yet, so you're seeing the patient by themselves. And so that is a stark difference between seeing patients in clinic versus seeing patients in the emergency room or trauma center. And you really don't have the luxury of kind of developing a relationship and kind of preparing the patient for surgery. In the trauma center and at the trauma hospital, it's kind of, you kind of just have to inform the patient that unfortunately they've got a situation that they have to go. But where the two begin to look similar is in the aftercare, and when you're able to get the patient out of the hospital and they go on to recovery, and then you see them as an outpatient, then it's nice to put family members, be able to meet the family members. You'll meet a lot of family members in the hospital after the surgeries and that kind of thing, but still it's just not the best environment to learn about patients and their families. But when you start seeing them in the clinic, that's when you start to learn more about their family life and learn more about who they are, because it's just the environment in the clinic is so much different than that of the hospital. I do a outreach clinic in Elko, Nevada, and so I go there about once every 4 to 6 weeks. And it's probably one of my most enjoyable clinics. I enjoy the people in Elko. I enjoy the people in Winnemucca and Battle Mountain and all the surrounding communities. It's a tradition that Dr. Rappaport started years ago, and I've just kind of picked it up and continued it because I've seen how valuable it can be, not only from a practice standpoint, but just from a personal standpoint. I was in Illinois practicing after I had graduated from University of Nevada. I took a fellowship in Illinois and ended up staying there and practicing in Illinois and at an academic type practice, and then moving here back to home to Reno. But the reasons I moved back to Reno are the same reasons I enjoy going to Elko. I drive. Currently I'm driving to Elko, and I enjoy the drive. It's peaceful. I can put on a podcast or books on tape and drive through the mountains, getting to Elko. The Ruby Mountains are beautiful. Just the scenery, to me, the wide open spaces of Nevada. But a lot of Elko is the people, the people that live there. They're all hardworking people in Elko. A lot of the working men and women are working in the mines, and it's fun to get into a small community like Elko and meet the people and hear their stories and learn about what they do and how they ended up in Elko and the history of Elko.